it's a time of planned indulgence. And I think the real key is the most acceptable food is that you can cut back on and eat in a moderate amount and not overstuff yourself. There's really no reason to go through the day and get bloated and then sick and then really regret it. So I have a few suggestions that I think would make a difference approaching Thanksgiving. And one of those is, of course, prepare the food properly, because turkey is notorious for varying bacteria fairly easily if it's left out. And, you know, it's a real classic thing to maybe make the turkey and have it sit out for a few hours while you make other things, and then eat and have it sit out a few hours and have people go back and eat some more. And I see them all the next day with upset stomachs, and it is amazing to me that the Friday and Saturday after Thanksgiving, there are a lot of people here sick to their stomach, and it's not just the overeating, it's the eating of turkey that's been sitting out. But if you prepare the food properly, and then I really encourage people, pick a few items that you really love and have moderate portions of them. Don't overdo. I think it's amazing how often people will tend to look at a line of food and say, well, you know, Aunt Myrtle made this pie, I better have some. It's not true. She'll be okay if you don't eat it. And, you know, if you don't like it, don't eat it. And I think that's a real key. And then try to fill your plate to the point where it's not full. Maybe I shouldn't say fill your plate. Plan your plate to where it's not full when you go there and eat. If you just keep on piling and piling on food, you're going to feel obligated to eat that. And unfortunately, you know, we all know what goes in does something. And once that's in your body, you're stuck. You know, you've overstuffed yourself. And if you just learn to divide that plate mentally into smaller portions and eat what you enjoy, but just don't eat too much of it.
So, Dr. Clothier, then, I mean, your advice really is, because I'm thinking in my head that at Thanksgiving, I'm not going to worry too terribly much about not eating mashed potatoes and gravy and yams and those things, because it's Thanksgiving, and I'm going to splurge. Now, I'm not going to do that every day.
Absolutely.
You know, but I'm going to splurge. So, rather than trying to be polite and make Aunt Bessie proud that you ate her corn stuffing, green bean, cream of chicken stuffing mix, which you don't like.
Exactly. I've never liked that.
Yeah, I neither. So leave it in the bowl and only get the stuff you like. Maybe make your portions considerably smaller, because you probably know you're going back for seconds.
Right, that's true too. So I would encourage you, take a look at your plate before you start, and then plan for an area of that plate to be empty when you finish going through the line to eat. To serve your plate, or however you do it, passing food around the table. Because another thing I always find amazing at Thanksgiving or a big meal is people say, oh, I better save some room for dessert, and I look at their plate and it's overflowing already. That's not saving room for dessert. What that's doing is overeating and then planning to eat dessert. So it'd be far better to mentally plan that spot for your favorite dessert, and again, just have a small portion of it, enjoy it, don't make yourself sick on it.
You know, and I think an important thing, parents, at least when I was growing up, used to say, well, you've got to clean your plate. And you really don't have to clean your plate. It's all right if you don't eat everything that you put on.
Absolutely. I appreciate you mentioning that. That's the type of household I grew up in. We would pass the food around until it was gone. And, we always had to eat everything. And I think it's perfectly fair and not insulting to anyone to leave something if you just feel too full. Or if you just don't like it, you know. You don't have to be that polite that you make yourself ill or unhealthy.
Well, and when we say clean our plate, don't we have dishwashers for that nowadays?
That's right. Absolutely.
We don't have to clean our plate. I mean, or we can set it down. The dog can clean our plate for us, right?
Yeah, my dogs love Thanksgiving.
Yeah, so when you hear the phrase from now on, clean your plate, folks, realize there's a dishwasher out there that can do that. Or if you've got a pet and you don't mind sharing, let your dog lick your plate for you. You know, but in all truthfulness, Dr. Clothier, you hit on something pretty heavy, and that is overeating at the holidays. And really, I've heard for years, pace yourself. I've overeaten. I've piled my plate full of stuffing and mashed potatoes and turkey and yams and fruit salad and all, because we say it's only once a year, but that once a year could be problematic for us, especially in our stomachs.
Absolutely. And it's interesting, we were tying this into heart disease, or at least planning to, and And it's actually been shown that a large indulgent meal can push you over the edge to heart disease, whether that's blood pressure related or literally clogged artery related. So you don't want to have some terrible event occur because you've indulged too much. And that goes for Thanksgiving, certainly through the Christmas season too. You know, if your place of work or school is anything like what I do, people bring treats nearly every day. And, you know, it's really easy to way overdo it. And I find myself actually having none of the treats, or else I'm sort of, you know, like hunting around looking for more of them because it's enticing, you know. But if you don't have the plan in mind to get through the season in a healthy way, I think you tend to blow it and then regret it. Instead, you should be proactive.
Yeah, those treats are addictive. I've always heard that there is a lot of people gain up to 5 to 7 pounds between Thanksgiving and Christmas. Is there any truth to that?
Absolutely. The national average actually is about 5 pounds. I've seen people gain 15 pounds easily. I probably personally have gained 10 or 15 in prior years. I'm planning to do much better again still. You know, it's just an ongoing battle because we have a lot of food. We're an indulgent society, and it's very easy to get out of control in that time.
You know, would you recommend, Dr. Clothier, because this is what I'm going to do during my holiday time, because you're right, in my office people are going to be bringing in pretzels with chocolate kisses on them with an M&M on top, or they're going to be bringing in cookies or brownies or breads. My plan is to bring in blackberries and raspberries and blueberries and some melons, so that while they're snacking on their unhealthy snacks, I'm going to be snacking on my healthy snacks. Now, I'm not going to say that I'm not going to eat too much of it, or I'm not eating what I should be portion control wise. But at least, is it better than eating that other stuff?
Oh, definitely. And some little, just a small, modest snack like a couple of almonds, well, maybe 5 to 10 almonds, actually can fill you pretty well, give you that crunch, as would pineapple, whatever. I think that's a great idea.
So maybe a healthy alternative, folks, if you're out there, and we're going to kick that around here after the break. But some healthier ideas in regards to things you can substitute during the holiday season. And then, Dr. Clothier, I'd like us to talk a little bit more about day-to-day nutrition and the impacts on cholesterol and heart. Because I know that we waged the war last time between the idea that cholesterol is generated by genetics versus food. So, folks, stay tuned as we're talking with Dr. Norm Clothier here in studio. What do you think? Is there anything that you just want to get out that you were not able to get out last time?
Yeah, actually, just because of Thanksgiving, I want to talk about heart disease and true thankfulness, which I'll throw in here toward the end of the segment, maybe. But
what do you want to come back with it after we do Lori? Do you want me to? What question?
Let's go ahead and talk about the controversy of cholesterol, and I'll mention an experience I heard from a patient this past week about that. And genetics.
Okay.
And then we'll get to the heart disease risk and the holidays in general. So.
Okay. Because I want to make sure you get to say. Yeah, I just want to make sure.
I appreciate that.
You get out what you want to say
out.
You know. That 30 minutes goes very quickly.
Oh, it does. Way too quickly, really.
Did you get some water, Dr. Clothier?
Yeah. Oh, great. Thank you. Appreciate it. Yeah, that's great.
Well, I'm coming in and see you on December 2nd.
Fantastic.
For my physical.
Let's see, I have to plan to take that day.
Yeah.
I'll
be bad.
Yeah. No, that's great.
But I'm going to be interested to see my blood work. I really am. I'm hoping that my cholesterol, good cholesterol, better be up.
Yeah. Yeah, I think I would anticipate that, but you never know until you check. Yeah. Absolutely. That'd be great.
Because the exercise, there's no doubt I've been hitting it, so.
Oh, and it makes you feel so much better, doesn't it?
Yeah.
I think we're made to move around, and it makes a big difference.
Yeah, we're not sloths.
Yeah, that's right. We may want to try to live that way, but
we're not sloths. But yes,
I have that two-toe deal.
Yeah, that two-toe deal. We don't carry organisms on our bodies.
Right.
Camp out. So we try to bring.
Absolutely. That's great. I look forward to that.
Yeah, I'm excited. I always like getting naked in front of you. There's something about that.
Yeah. It's a good thing it's commercial break.
Yeah.
That's the thing about that.
I did that for purposes of Josh and Christine.
Yeah.
And Callie. Of course, you've never made
They
me
some,
that.
yeah, I was going to say, they don't know how nice I am. I don't do that kind of thing. I'm a clothier. I'm into those
There you
clothes.
go.
Yeah,
I'm into those clothes.
absolutely.
That is funny. Now, is there anything on, because we can always come back and talk about this another day as well, between the races, is there huge health differences amongst men and women?
That is a great question. I'd probably rather address that another time, maybe when we're talking about maybe some racial issue, health related stuff. Just because that is a large can of worms too. But there definitely are there are racial differences, and then there are male-female differences that I think we could go into, but I don't think there'd be time.
Right, not today, but I'm just
Yeah.
saying for future. I'm just
Yeah.
thinking out, since I've got you here.
Yeah, that'd be a
I
good
have
one.
a question.
Uh-huh.
I don't know if it's true, but
Yeah.
is it true that black people, their bones are like, they're different than ours?
No.
That's not true?
No,
Okay.
I mean,
just
I've
think
heard
it was.
that. There is a difference in muscle,
All right, we're about 30
So-
seconds out.
but no,
Okay.
no.
I thought that sounded
Except
ridiculous,
that small white women get osteoporosis more easily for unclear reasons. But that's it. But everybody starts out with the same hope of bone strength.
That's what I thought.
That's right, folks. It's Blue Eyes, and you're just now rolling out of bed. This is a great way to roll out of bed because you know you've got the world on a string, and especially if you're listening with JP and Dr. B and waking up here in the Dallas-Fort Worth area. Good morning, Dr. B.
Good morning, JP. What a great morning to wake up, right?
What a great morning.
In
What a
the
world.
morning is a
So,
great
which
What a
one of
wake
you
up.
is singing? Is what I'm wondering.
Well, I think that's Mustang Callie singing.
Yeah.
I think that's Mustang Callie. Well, folks, tell you what, we've got Dr. Norm Clothier, our expert resident doctor here in studio. We're talking men's health. We're about to rage the battle about men's cholesterol, and is it really more genetic or is it more food-based? We've got Josh Allen in studio this morning. He is our guest co-host. He won our drawing. He's also going to be our Wednesday feature. We're going to talk about childhood cancer on Wednesday and what he has to be thankful for because he's been battling that cancer since he was about 10 years old. And so we're excited to have our guest co-host, Josh Allen, in the studio. Good morning, Josh.
Good morning, John.
All right, and we got Action Jackson back there behind the glass. Action, how are you this morning?
Yeah, moderation's the key.
Yeah, no
Talk about
indulging
that here in a
action.
minute. Yeah. It does. It
better.
can.
It better.
And you can
Some
be
of us.
thankful that you can cut back and feel good at the end of the day.
That's right, and we've got Mustang Callie in studio. She is going to give her first ever traffic report
I am.
at the 6:30 hour. So you want to tune in for that and hear about your traffic going into work this morning. But before we do that, let's get a little inspired before we talk about the dangers of cholesterol. Lori, are you on the line with us?